Assalamu alaikum. Uh, my name is Dr. Abdul Wahab, Associate Professor, Department of Pharmacy, University of Science and Technology. I am a course instructor for dispensing pharmacy, and our today topic is preventing dispensing error. So, discussion outline, as you can see over here. First of all, we will discuss about the dispensing error, and then most prevalent dispensing error, types of dispensing error, causes of dispensing error, steps for maximizing dispensing accuracy. So these are the different headings, as you can see over here, for our today discussion. So dispensing error, as you can see over here, dispensing error, the numbers. So 98.3% accuracy in dispensing medications. If there is dispensing of medications, so according to one report, there is 98.3% accuracy, while there is 1.7% inaccuracy rate. So it may be different, but according to one study, so as you can see over here, that the accuracy rate and dispensing medication is 98.3%, while the inaccuracy rate is 1.7%. So over 3 billion medications dispensed per year all over the world. Over 3 billion medication dispensed per year, and you can see over here 4 errors per day per 25 prescription filled. So if there are 250 prescriptions, so there are chances of 4 errors per day. Over 51 million dispensing errors per year. So as you can see over here, the most prevalent dispensing errors: dispensing incorrect medication. These are the most prevalent dispensing errors: dispensing incorrect medications, dosage strength or dosage form, dosage miscalculation, failure to identify drug interaction or contraindications. So these are the most prevalent dispensing errors. Types of dispensing error: commissions versus omission. It is a type of dispensing error. Mistake versus slip. Potential versus actual. Errors of omission: failure to counsel the patient, failure to screen for interactions and contraindications. These are errors of omission. Similarly, errors of commission: miscalculation of dose. It is errors of commission, miscalculation of a dose. Similarly, dispensing the incorrect medication, dosage strength or dosage form. Dispensing the incorrect medication, dosage strength or dosage form. Mistakes and slips. Mistake: do things intentionally, but actions are incorrect because of a knowledge or judgment deficit. Similarly, behavior in problem solving mode. Example: dose prescribed that exceed maximum safe limit. As we have discussed in our previous lecture about the maximum safe concentration, minimum safe concentration, toxic level. So example over here is dose prescribed that exceed maximum safe limit. Slip: do things unintentionally. Incorrect because of an attention deficit. In mistake, do things intentionally, but actions are incorrect. But over here, do things unintentionally, incorrect because of an attention deficit. Behavior in automatic mode. Example, dispense chloropromazine when prescription was clearly written for chloropropamide. So it is slip. It is also prescription error. Dispensing errors, common causes. What are the common causes of dispensing errors? Work environment, workload, distractions, work area, use of outdated or incorrect references. Dispensing error, improving workload, ensure adequate staffing levels, eliminate dispensing time limit. Examples of limiting workload: dispense less than 150 or 150 prescription per pharmacist per day. Example of limiting workload: dispense less than 150 or 150 prescription per pharmacist per day, and the limit should not be exceeded. If we want to improve the workload, so it is the limit that one pharmacist must dispense 150 or below 150 prescription per day. Require breaks every 2 to 3 hours. There is requirement of rest break for improving workload or for elimination of dispensing error. There must be a rest break every 2 to 3 hours. Brief warm-up period before restarting work tasks. Before restarting work tasks, there must be warm-up period before starting work tasks. Required 30 minutes meal breaks. Dispensing error, combating distractions: phones, fax machine, auto refill, voicemail, priority processing, trained support personnel. Prohibit distraction during critical prescription filling functions. Centralize filling operation. Trained support personnel to answer the telephone. So if you want to combat distraction during the dispensing, so these are the different factors on which we should have a control. Dispensing areas in the work area. Clutter. Ensure adequate space. Store products with the label facing forward. Choosing high-use items on the basis of safety as well as convenience. Use original containers. Telephone placement. Poor ergonomics. Lighting. Heat, humidity. Noise due to TV or radio. Similarly, dispensing areas in the work area, labels on the bins and shelves. Failure mode, bin label may decrease chance that the actual product label will be checked. When the selected from bin using barcode will decrease chance of error. Similarly, separate by route of administration: external, internal, injectable, etc. Use auxiliary labels for externals. Amoxicillin oral suspension for ear infection thought by parents to be drops administered in child's ear. So such type of product or dosage form should be label. Auxiliary label for such type of dosage form is a must. Review published safety alerts for look-alike, sound-alike drugs and frequent dispensing errors. Cognitive and social factors. Use of high-intensity task lights and magnification. Use of a device to hold prescription order at eye level. Posting alerts in strategic locations with error-prone products. Use of exaggerated, unconventional type fonts to enhance reading of drug names. Well-designed drugstore, adequate space, label facing forward. Agents for external use should never be stored with oral medications. Separate by route of administration. Mark or isolate high alert drugs. Separate sound alike and look alike drugs. Errors related to information about the drugs or patients. Misleading or erroneous references. Ambiguity in handwriting and typed documents. Computerized prescribing. Wrong patient errors. Errors in dosage. As you can see over here, poor communication dynamics from a published reference. It is illegible. So similarly, ambiguity in writing in written orders. It is not clear that what has been prescribed by the prescriber. So there is ambiguity in written orders. Computerized prescribing errors. Computerized prescriber order entry improves communication and reduces some types of errors. However, this technology may have its own pitfalls. Lowercase l may look like the numeral 1. Letter O may look like the numeral 0. Letter Z and the numeral 2 may be misread. Wrong patient or wrong drug chosen from list. Computerized alert. Computer system can be configured to flash maximum dose alerts and other safety alerts. Upgrades are necessary and usually available from software vendors. Optimal capabilities of pharmacy computer software to prevent dispensing errors. Dose limits, allergic reaction, cross allergies, duplication of drug ingredients, drug interactions, contraindicated drugs or drugs that needs dosage modification. Errors in dosage. Mathematical errors and decimal point misplacements are common causes of errors, especially in conversion between micrograms and milligrams. Similarly, oral liquid medications can be dispensed improperly because of misunderstandings with reading and labeling of oral syringes or use of such devices by parents of pediatric patients. Dispensing errors caused by poor labeling. Dispensing errors caused by poor labeling, pharmacy computer generated labeling, and production of medication administrations records should be optimized. Being a pharmacist, it is your responsibility that pharmacy computer generated labeling and production of medication administration records should be optimized. Non-essential information should be excluded from labels and reports. Samples may be poorly labeled. Syringes and admixture labels. Standardization of the way labels are placed on syringes can reduce errors. Similarly, use for oral use only labels on oral syringe Placement of labels on intravenous bags, warning labels for special parenterals, Vinca alkaloids, other anti-neoplastics, medications with specific infusion rates. Our outpatient label contains patient name, medication name, dosage strain, dosage form, quantity, direction for use, number of refills, prescriber name, purpose of medications. Similarly, dispensing error caused by poor patient education, failure to adequately educate patients. If there is failure to properly educate the patient, then there will be chances of dispensing error. Lack of pharmacist involvement in direct patient education. It is must for the pharmacist to engage himself or herself with the patient. Failure to provide patients with understandable written instructions. If pharmacist is unable to provide written information for the understanding of the patient, then there will be chances of dispensing error. So written information must be provided to the patients. Lack of involving patient in check systems. It is must to give opportunity to the patient to involve in the check system. Otherwise, there will be chances of errors. Not listening to the patient when therapy is questioned or concerns are expressed. So it is the responsibility of pharmacist to listen the patient. The questions raised by the patient should be answered by the pharmacist. Good patient education. Inform patients of drug names, purpose, dose, side effects, and management methods. It is the responsibility of the pharmacist to inform patients about the drug names, purpose, dose, side effects, and management methods, and also suggest reading for patients. Inform patient about right to ask questions and expect answer. Listen to what patient is saying and provide follow-up. Counseling. Up to 83% of dispensing errors can be discovered during patient counseling and corrected before the patient leaves the pharmacy. So it means before going to dispensing, counseling is must. The pharmacist should counsel, should give advice properly to the patient. Assessing prescription. Clearly eligible handwriting. Clarify eligible handwriting. Non-standard abbreviations or incomplete information. Analyze patient's profile. Being a pharmacist, these are all your responsibility. Review drug interactions and allergies. Verify appropriateness of medication and dosage. Consider computer alerts. Highlight unusual dosage form or strength. Highlight unusual dosage form and or strength. 10 steps to maximize dispensing accuracy. First one, lock up or sequester drugs that could cause disaster errors. Second, develop and implement meticulous procedures for drug storage. Reduce distractions. Design a safe dispensing environment. And maintain optimum workflow. Use reminders such as labels and computer notes to prevent mix-ups between look-alike and sound-alike names. Fifth, keep the original prescription order, label, and medications container together throughout the dispensing process. Number 6, compare the contents of the medication container with the information on the prescription. Enter the drug identification code, national drug code number, into the computer and on the prescription label. Perform a final checks on the prescription label and manufacturer's container. When possible, use automation barcoding. 9. Perform a final check on the contents of prescription containers. Last one, provide patient counseling. Patient counseling is must. If you want to reduce the prescription error, so the pharmacist must give advice, must counsel the patient. Thank you so much. So it was all about the preventing dispensing error. See you again. God bless you.